Hi, my name is LisaMercier, and I'd like to talk to you today on the importance of having a personal health record. A personal health record allows you to collect certain information about your health. You need to know what information is important, why that information is valuable, and how to store that information. Have you ever gone to the doctor's office and the receptionist gives you a list, a paperclip with papers, and one of it's going to include a medical history? What about meds? When you get to answer those questions, do you know your medicines you're on and the dosages? What about the surgeries? They're simple questions, but half the time we don't know the answers. As a caregiver for many years for my husband who suffered a stroke and an elderly aunt, I felt like at times, sometimes I was having to juggle their current medications, their chronic conditions, the upcoming procedures, or the appointments they had. I couldn't keep up with it all. And so I started having them a personal health record that I kept in my purse at all times. And so I'd like to inform you today on the importance of why you need this personal health record. The value of having one also. A personal health record needs to contain certain information. It's information that you've collected about your health. Let's look at some of the information that you need to have. Well, your personal health record needs to have your name, an address, and a date of birth. It needs to include current medications with the dosages and the instructions on how to take those medications, such as 1 time a day. It also needs to include any surgical procedures with the dates, significant illnesses or conditions such as hypertension and diabetes, any allergies that you may have to food, drug, and even some other substances such as latex. Your family history, any hereditary conditions, recent doctor visits, such as what test results you might have had and the results of some of your lab results, any vaccinations or immunizations you've had, such as your influenza, pneumonia vaccine, and even a tetanus shot, emergency contacts, who they can contact in case you have trouble. Also provider information. You need to have the names of your specialists, dentists, even your pharmacies. It's helpful to have the name, the address, the phone and fax number in case they need to contact that person while you're there during an office visit. They have the information. Also helpful to include is your insurance information, your policy number, and a contact phone number so they can reach that information to help you in case you have a problem with a bill. It concerns your health care. So now that you see what some of the information you need, there's also some documents that you might need to contain in your personal health record. These include maybe x-ray results, lab results, the last discharge instructions that you have. It also is helpful to have, you can have maybe a health log or a diary, such as your daily blood pressure readings or your glucose levels. Maybe you need to have also with what you want to discuss with that doctor on your next visit. How many times have you left and you said, I meant to ask the doctor, it's too late, your time is gone. What about an advance directive or a living will? These are vital documents that you need to have copies of also because they give the provider direction on what type of medical action to take against you. So it involves your health care. So you want to, now that you know that what basic information that you need in your personal health record, you might need to know, well, how is this information valuable to me? So with comprehensive information all in one place that you can get your hands on readily, you need to have the potential to be more actively involved in your health care. You're able to discuss questions with your doctors that you may have. It also helps doctors work more quickly. They also have the lab results at their disposal. What if the pharmacy's not open at that time of the night and you don't know the medicines you're on? So that's information that's why this is beneficial to you. It also avoids duplicate tests. It even saves lives. My husband suffered a stroke at age 47. One day he passed out at a business. I received a phone call saying that an ambulance had been called and they needed to know what medicines he was on. After dealing with my husband's medicines daily for 10 years, I couldn't tell them at that time the medicines or the dosages. In that scary moment, I had nowhere I wanted to get to my husband. But I stopped and I reached into my wallet and I pulled out his personal health record. I told the paramedic over the phone what medications he was on, the dosages, and I even gave him a brief history about his stroke. And at that time, I was able to join him later. He had a pacemaker placed the next day, and I promptly wrote the date, the doctor, the model number of that pacemaker, and kept that information with me. I updated his medical record at that time. It's extremely important that you date events because time becomes lost or confused in your memory. So it is very vital that you update and keep your information updated. According to a recent article by the Mayo staff, what does a personal health record do? Well, it empowers you. It helps you to manage your health care. By helping your visits, between visits, you can keep your information such as your weight loss and your blood pressure readings. You can record progress on whether you're losing weight. It also helps you be prepared with questions about your medications or your future treatment plans. It also helps you to organize your upcoming visits so you don't miss those long-awaited, hard-to-get appointments or those yearly preventive screenings that you need. So now that you know what information to gather and why it's valuable, let's look at how to store this information. Well, this can be as simple as writing it on an index card, or it's also maybe keeping it in your wallet so you'll have that information. Even putting it in a Word document and storing it on your computer, as you can update it there. Put it in a laptop even and take that with you to your doctor's office. But in case of an emergency, you don't always have that with you, but you pretty much always have your cell phone with you. So if you don't record anything, go to the memo section of the notepad and put that your medications and the dosages at least in there. That's an important thing to have. So at least you have that with you at all times. And then when you get home, you can also store it in a file folder. You pretty much have that already when you keep your discharge instructions. You've already started one. Now just add to it with some of the other information that we have. And so there's various ways that you can keep your personal health record. It can be simple or it can be as complex as you want it to be. In conclusion, you know that the value of recording and storing your information, but be sure to keep it in a convenient, accessible, and secure location. A personal health record is a simple but valuable tool. Managing your health care is something that you need to take that empowers you. I know my medical history. Do you know yours?